Welcome to this video, where we'll be discussing bladder tuberculosis, a less common but serious infection of the bladder. We'll explore its causes, how it develops, its symptoms, and how it's treated. By the end of this video, you'll have a comprehensive understanding of this condition. Bladder tuberculosis is almost always secondary to tuberculosis elsewhere in the body, most often the lungs. The primary cause is Mycobacterium tuberculosis, the bacteria responsible for tuberculosis. The bacteria spreads from the primary site of infection, such as the lungs, through the bloodstream to the kidneys. From the kidneys, the infection then descends through the ureters to the bladder. Direct inoculation, while rare, is also possible during procedures. The pathophysiology of bladder tuberculosis is a multi-stage process. First, M. tuberculosis reaches the kidneys via the bloodstream, leading to renal tuberculosis. The infection then spreads to the ureters and eventually to the bladder. Initially, small tubercles or lesions form in the bladder wall. These tubercles can then ulcerate, leading to inflammation and scarring. As the disease progresses, the bladder wall thickens and loses its elasticity, reducing its capacity. In severe cases, this can lead to a shrunken, fibrotic bladder. Bladder tuberculosis is relatively uncommon, especially in developed countries with effective tuberculosis control programs. It's more prevalent in regions where tuberculosis is endemic, such as parts of Africa, Asia, and Eastern Europe. Individuals who are immunocompromised, such as those with HIV or those undergoing immunosuppressive therapy, are at a higher risk. Also, patients with a history of prior tuberculosis infection are more susceptible. The signs and symptoms of bladder tuberculosis can be varied and often mimic other bladder conditions, making diagnosis challenging. Common symptoms include frequent urination, urgency to urinate, pain during urination, known as dysuria, and blood in the urine, also called hematuria. Patients may also experience lower abdominal pain or flank pain if the kidneys are also involved. Sometimes, systemic symptoms like fever, night sweats, and weight loss may also be present, especially if the primary tuberculosis infection is active. Diagnosing bladder tuberculosis requires a combination of clinical evaluation and laboratory tests. A urine culture is essential to identify the presence of M. tuberculosis. However, it's important to note that urine cultures can sometimes be negative, even in the presence of infection. Microscopic examination of urine may reveal white blood cells and red blood cells, but is not specific for TB. Imaging studies, such as an intravenous pyelogram or CT scan, can help visualize the kidneys and bladder, revealing any abnormalities such as lesions, strictures, or calcifications. Cystoscopy, a procedure where a small camera is inserted into the bladder, allows direct visualization of the bladder lining and enables biopsies to be taken for microscopic examination and culture. A tissue biopsy is often the gold standard for diagnosis, as it can confirm the presence of granulomas, an acid-fast bacilli characteristic of tuberculosis. Bladder tuberculosis doesn't have distinct classifications or types in the way some other diseases do. However, it can be classified based on the severity of the disease and the extent of bladder involvement. For example, it can be categorized as early, moderate, or advanced based on the degree of bladder wall thickening, scarring, and reduction in bladder capacity. The primary treatment for bladder tuberculosis is antituberculosis medications. These drugs are typically administered for a period of 6 to 9 months. Commonly used medications include isoniazid, rifampin, pyrazinamide. In some cases, surgery may be required, particularly if there are complications such as bladder contracture or ureteral strictures. Surgical interventions may include bladder augmentation, ureteral reimplantation, or in severe cases, cystectomy, which is the removal of the bladder. Management also includes supportive care to alleviate symptoms, such as pain medication and bladder antispasmodics. Preventing bladder tuberculosis relies heavily on controlling the spread of tuberculosis in general. This includes early detection and treatment of pulmonary tuberculosis, as well as BCG vaccination in areas where tuberculosis is endemic. Individuals who are at high risk of contracting tuberculosis, such as healthcare workers and those living in close contact with infected individuals, should undergo regular screening. Prompt treatment of latent tuberculosis infection can also help prevent the development of active disease, including bladder tuberculosis. With appropriate treatment, the prognosis for bladder tuberculosis is generally good. However, delayed diagnosis and treatment can lead to complications such as bladder contracture, hydronephrosis, and renal failure. Recent research has focused on developing new diagnostic methods for early detection of bladder tuberculosis, as well as shorter and more effective treatment regimens. Researchers are also exploring the use of immunomodulatory therapies to enhance the body's immune response to M. tuberculosis. Continued research and advancements in treatment are crucial for improving outcomes for patients with bladder tuberculosis.